if you're a Tennessean who's interested in better connecting education and work, better preparing students for careers, reimagining pathways for students from K-12 into the workforce or from higher education into the workforce, and I think importantly, be inspired to take some of the things that we'll be elevating in this series back to your own community to implement in your own work.
We recognize there is a disconnect between education and the workforce. By bringing together education and industry together, we can erase the lines in the sand and better prepare our students for the future.
Oh, there we go. Good morning. Thank you all so much for being here this morning. Great to see everyone today. And excited to kick off our second event in our Preparing Students for Tennessee Careers SCORE Institute Summer Series. I'm David Mansouri. I serve as the President and CEO of SCORE. And I'm excited to kick off our conversation today, introduce our expert, our featured guest who will be presenting today, and then hear from an amazing panel of Tennessee leaders reflecting on this work. So we know that Tennesseans want access to great jobs that allow them to support themselves and their families, and Tennessee's businesses are seeking highly skilled workers to meet changing needs. We also know that our education system is not preparing all Tennessee students for today's careers. A recent poll conducted by SCORE found that most Tennesseans believe the purpose of education is to prepare students for careers. But at the same time, Tennesseans do not believe that our education system is adequately doing that for all students. Concerningly, there is also a mismatch between what students learn in K-12 education and what many students are expected to know when they enter the workforce. So that's why SCORE launched this 5-part SCORE Institute series, really focused on elevating innovative practices and policies from across the country that address challenges to preparing students for high quality, in-demand careers. So we're bringing together education leaders, business leaders, policymakers, community leaders for these monthly 90-minute events to explore a wide range of topics that really look at the intersection of education and work and look specifically about how that connection can be reimagined and strengthened to better support students. So during each session, we'll hear from a national expert. We will hear from Tennessee leaders reflecting on how these innovative practices could inform our work in Tennessee. And we also know that employers are more eager than ever to build partnerships to ensure that employees have the skills and training needed to be successful. And so it's our hope that these sessions really can empower and inspire the folks who are here with us today and the folks that are joining us virtually to engage in the education system in a way that allows us to make sure that students are better prepared for workforce needs. Tennessee's workforce continues to grow each year with approximately 400,000 job openings today. We also know that there's significant economic projected growth continuing for our state as well. And with that economic growth, a strong policy foundation as a state, and a really strong commitment to innovation, this we think presents a really important opportunity for stakeholders to really come together and reimagine this education to work pathway. So today we are excited to continue this series with a session focused on high school models that lead to jobs. And this session will explore industry-aligned school models, specifically at the high school level, that shorten the timeline for students to receive a high-quality credential and enter a career with the skills needed to succeed. So a couple of data points here. National and local headlines have shared about the declining undergraduate and community college enrollment following the COVID-19 pandemic. This is data that I know everybody in this room knows. And in recent years, the number of Tennessee high school graduates immediately enrolling in post-secondary education has dropped from 2019 to 2021. We obviously saw some data that came out last week that showed some signs of improvement around the college-going numbers, but still some significant drops. And in response to this college-going decline, SCORE commissioned and released a study in February of this year to look at the value of college and post-secondary degrees. And the study really provided some recent data that shows that earning a post-secondary credential is associated with higher earnings over the course of a student's career. Specifically, the data also highlighted the additional earnings of workers with a post-secondary credential related to high school educated workers. And we know that the income premium tends to widen at mid-career, with workers with an associate's degree, for example, earning about 11% more than a high school graduate at age 25, and about 20% more at age 50. The additional lifetime earnings of the average worker with an associate's degree over one with a high school education is about $375,000. Yet, despite these additional benefits, formal education ends with high school graduation for more than a third of Tennessee's high school seniors. And for students of color and low-income students, college-going rates, as we all know, are even lower. There are many factors, obviously, that are preventing students from continuing on to post-secondary education. In 2020, SCORE worked with our partners at Tennessee Achieves to conduct a survey of Tennessee high school students and found that the two of the main reasons why students ultimately chose not to go to college were that they started working and that college was not affordable. And in some follow-up focus groups, post-secondary preparedness and academic readiness were also identified as reasons that students chose not to pursue some form of post-secondary education or training after high school. So it's important that we understand the value of a post-secondary credential or degree as we consider the options available for students in our state, and really know and believe that Tennessee's K-12 education system has the opportunity to provide students with access to early post-secondary opportunities that lead to high-wage, in-demand careers, while also addressing factors that prevent students from continuing on to post-secondary education. And these opportunities can include things like industry credentials earned in high school, certificates and diplomas at technical colleges, and of course also traditional college degrees from community colleges and four-year universities. In Tennessee and across the country, innovative high school models are one important option that can prepare students for workforce opportunities early. It can be tailored to specific workforce and industry needs, provide students with a post-secondary credential of value in addition to a high school diploma, shorten the amount of time before students earn a living, and give students the credentials to work while pursuing a post-secondary education if they choose to do so. So one example of this really sort of innovative approach to high school is the Rhode Island Nurses Institute. The school graduates high school students with a certification as a certified nurse assistant and up to 20 college credits toward bachelor's degrees in nursing. The intentional program design means that students can work as a certified nurse assistant while pursuing post-secondary degrees and are also academically prepared when they enter post-secondary education. While we'll obviously hear about this specific model in Rhode Island today, there are other models across the country. Another one I would mention is Tech Valley High School in Albany, New York. Students at Tech Valley earn college credit towards an Associate of Science degree and also engage in a month-long full-time internship that provide workforce-relevant credentials and training while still in high school. We'll spend, after we hear from Pamela, we'll obviously have a panel discussion where we'll hear some additional ideas and opportunities around innovative high school models, specifically in Tennessee, and some things that stakeholders and leaders across the state are doing to pursue these kind of intentional models of high school focused on career preparedness. Despite having these models in Tennessee, across the country, we also know that in Tennessee specifically, too few students are receiving credentials while in high school. And I want to just elevate one specific data point here. In 2022, just 300 out of more than 70,000 Tennessee high school students earned a post-secondary credential through dual enrollment, which is one of the early post-secondary opportunities that can provide students with the option to earn a workforce-demanded credential alongside a high school diploma. This is also despite the fact that the state is prioritizing dual enrollment grants that allow students to take up to 5 dual enrollment courses for free. So it's clear that post-secondary credentials are needed to fully prepare students for careers that enable economic independence. And we also know that we can do more as a state to increase the number of students who are graduating high school with a post-secondary credential of value and are prepared to enter the workforce and an in-demand industry. So today we'll dig into this conversation around strengthening innovative high school models that prepare students for jobs. And we'll begin by hearing from Dr. Pamela McHugh, who's the CEO of Rhode Island Nurses Institute Middle College. Dr. McHugh will share about her organization and how the organization has developed a successful industry-aligned high school model that prepares students for the workforce and post-secondary opportunities. Following Dr. McHugh's remarks, we'll have time for some Q&A with Dr. McHugh. So as she's presenting, think about any questions that you may have for her. We'll facilitate a Q&A session. And then we'll hear from our panel of Tennessee K-12 higher education and workforce leaders discussing opportunities to strengthen and expand these kinds of models in our state. So I'm now excited to introduce and welcome Dr. Pamela McHugh, who's the CEO of Rhode Island Nurses Institute Middle College. Dr. McHugh is an experienced leader who envisioned an innovative high school model to drive the reinvention of the nursing career. A registered nurse who began her nursing career in Rhode Island, she holds a BSN in nursing, an MS in nursing administration, and a PhD in nursing, with a research focus on nursing workforce diversity. Prior to her career founding Rhode Island Nurses Institute Middle College, Dr. McHugh was the director of nursing education for the state of Rhode Island and the executive director of the Rhode Island State Nurses Association. Dr. McHugh founded the Rhode Island Nurses Institute Middle College, the flagship school in the Nurses Middle College Network, in 2011. And as you'll hear more in just a moment, the goal of the school is to provide an early foundation in nursing education for high school students who have chosen to pursue education and careers in nursing and healthcare. And again, you'll hear a lot about this from Pamela, but through a really rigorous academic program, hands-on skill practice, field studies in hospitals and nursing homes, and practical internships, students are connected directly to and are prepared for a future industry role while they are in high school. Students graduate Rhode Island Nurses Institute with a high school diploma, a workforce certification as a certified nursing assistant, and up to 24 college credits with a baccalaureate degree in nursing. We are excited to welcome Dr. McHugh this morning to share more about this model, and I hope you all will join me in welcoming her today.
Thank you. Good morning. So imagine there is a whole graduating class of high school students who already know and are passionate about a career in healthcare. Imagine that regardless if they're the first of their family to graduate from high school or college, they see an extremely clear pathway to their dream career, and the barriers are eliminated. And in fact, they're well on their way, because at high school graduation, they have already mastered college credits and are well on their way to their career. And it's accelerated. Imagine a healthcare system, the local healthcare systems are thriving, and they have a workforce that truly represents the community in which they care for. The demand for healthcare providers the supply far exceeds the demand. And instead of focusing today on filling shortages, they are looking at succession planning. And in fact, the local community is a destination of choice for families because the educational system is outstanding and it's a thriving, healthy community. That's what we thought about at the Rhode Island Nurses Institute Middle College. And that led to really, what is our theory of change with this model? We even rose it up a little bit. The problem that we are trying to solve is health outcomes in this country do not meet the amount of money that we spend on. We have the highest rate of chronic diseases and the highest rates of avoidable deaths. We have inequities and disparities built into our system. We have an aging healthcare workforce, and the pandemic caused burnout and exacerbated that burnout and the shortages. So our intervention, a nursing healthcare pathway program for high school students. We started in the workforce, we looked down the pathway, and we said, what are some of the barriers and how can we eliminate those barriers? We also know the demand for nursing and other healthcare providers existed, and it continues, and we're not seeing any alleviation in the near future. And so to create a dedicated pipeline to fill high demand jobs in the workforce, we believe that is the solution. And the future that we envision is that US health outcomes exceed other developed countries. Supply meets the demand for experienced, diverse, passionate healthcare providers. The healthcare workforce represents the community in which they serve. And healthcare careers offers a very meaningful professional pathway for students. So the mission of the Nurses Middle College is simple: to prepare a diverse group of students to become the highly educated professional nursing workforce. And how we do that, our vision at the school level, is we created an innovative high school experience, student-centric, and just committed to developing the knowledge and skills and passion to exceed in nursing and the healthcare professions. So our model, as we described, the key design elements, we are a college and career prep. The entire curriculum is a rigorous college prep curriculum. We infuse nursing and healthcare knowledge in every single core content subject. Why we do that? Number one, at 9th grade, we're creating informed healthcare consumers, young, but also too, our students. How many times have we heard, why do I need this subject? How is it going to help me in the future? They are 9th graders at 14 and 15 and saying, I'm already preparing to be a nurse. I'm already preparing to be a pharmacist. So that it keeps them engaged in their classwork, and they see that pathway. And of course, very important is our dual and concurrent college enrollment. Our students begin taking college level courses, the prerequisites to many of the healthcare provided degrees, beginning in 10th grade, and they continue on 11th grade. They begin to take it on our campus. And then in later years, they're on a college campus. And those are transferable college credits. So they're free. And they, as you heard, they can earn significant college credits, which is going to save them money and accelerate their college journey and get to the workforce sooner. Also, too, we say they're college and career ready. They've mastered college level coursework. That is one of the indicators in the research for entry and persistence in college when you can already master. Also during this curriculum, beginning in 9th grade, many of our students in Providence, first in their generation, not only to go to college, but also to even graduate from high school. So when we say college, what does that mean? So 9th grade, come, welcome, and we're going off to a college and we're going to walk around and we're going to see. So then that puts, when we talk about college and the messaging that continues through their entire high school experience, they can put that in context. The other key design element is the healthcare experience. Internships. We have credit-bearing internships that are very important. We socialize our students to the profession and system of healthcare. And this is not a job shadowing. This is intentional. It is rigorous internship. What we do is on certain days of the week, classes end at noon. And all our students then go to an internship for a semester, entire semester. And we work with our healthcare partners, and our internship program is based, what is your passion? Many of our students have many internships. I would like to go into pediatric oncology. They're talking like this as sophomores in high school. Pediatric oncology, well, okay. And so we provide that experience, and then they find out that is not for me. It is good to know what you don't want to do that early in high school. So we expose them. So that's when I say, when they graduate at 12th grade, they are passionate and they see the path very clearly. And also a key design is the entry-level workforce certificate. And in our curriculum, we have our curriculum, and we plug in Rhode Island, the need is the entry level is the CNA. So we plug in the CNA. Our students go to math class, English, CNA, and that's a rigorous program. And that also allows them to have even more internship experiences because they have a license, which is minimal competency. So they've already received, they understand HIPAA, they understand, but, and oftentimes that license turns into after school job, summer job. And in many instances, our students are telling us they're making more than their parents. And this is what's also going to sustain them as they go to college. Now I've been asked, oh, the CNA. So, do they stop at that? No, because in 9th grade, we introduce to college. We show them the pathway. We show them the possibilities. So the goal and the dream is always the advanced. And so they see that pathway. And also personal development. And that's the social, emotional learning. That's really preparing them. We call these our pillars of nursing. They are the soft skills in the workforce. They are also essential skills for life. And we not only, I always say, they're not just words on walls. We define them. They're in our faculty's job description. Our students experience them, and then they must demonstrate them in order to go into an internship and as part of graduation. This also is what makes us a nursing middle college, this is our interdisciplinary approach. And this is what we do in healthcare. It's patient-centered care. In order for a patient to have an excellent outcome, there's lots of providers, there's lots of teams, and we have to really focus on the holistic approach. That is the essence of nursing. And this is what we do at the school. We do student-centered education, and we deliver education through a lens of health. So yes, we're a school, and yes, we're about math proficiency and ELA proficiency and mastery of college coursework. But sometimes there are things going around a student in their family or in the community that they can't focus on that. So we have an interdisciplinary team, and we really coordinate together, and we focus on the whole child and family and remove those barriers. And that is some things that we can do in the school, or connect to outside community resources to get family, so then our student can see that clear pathway. I've described the 3 design elements, and I think that you heard very clearly, we don't do this alone. And we have key partners to success. I think what also makes us a unique model is we are industry run. We are the nurses, we are the healthcare providers. We created the school. Our board is governance, is nursing leaders and healthcare providers. And they understand the mission and they see the return on investment. So on our board are our partners, post-secondary institutions. These are our colleges of nursing, our deans, our professors. We need them. Not only do we need them at the board level, what are you seeing in your institutions? What are you seeing where students are not prepared. We need that guidance. If we're going to create that seamless pathway, then we need to start developing those skills long before they get to college so they can go into the workforce. Also, our post-secondary partners, those are the ones who help, who we connect the college courses. As I said, we begin college coursework as early as 10th grade. And then our students go on to a college campus, and those are the courses that we would receive from our post-secondary partners, and we would, and they need to be transferable. Many of our students go direct, they see that direct pathway and pipeline right to their post-secondary partners. We asked that beginning in 9th grade, access to campuses. I remember when we first opened the school, we'd say, okay, we'd like to take our 9th grade classes. And they said, no, we like 11th graders for admission. And so we had to, work with our partners, because you can't think about college if you have no context of college. And so that's what we ask for our post-secondary partners and mentors. We have many of our college faculty who go and meet with our 9th graders and 10th graders. And talk to them about their school and their institutions and their skills. And again, it keeps them engaged. They see in 9th grade, 10th grade, where they want to go, what they need to do, and that really keeps them focused. Our other key partner is our healthcare employee. These are our practice partners. They're the ones that rely on to partner with us to offer internships. And this is not job shadowing. This is a commitment for internships. But our healthcare partners in Rhode Island and in New York, also, they see the return on investment. We will never, we promise our post-secondary partners and our healthcare employers, we will never give you a child that is not prepared. That is our commitment. That go with the pillars of nursing, and we look at attendance and academic achievement. So they're going to your institutions fully prepared, and we do evaluations. We have faculty that follow them. It's an important partnership that we value with our healthcare partners. Also, too, they serve on our governance board. Healthcare and education are changing. What are the industry trends? We're an industry-run school. What are you seeing in the practice setting? What skills are needed? What is happening? We're not preparing nurses and pharmacists. We're preparing the foundation, but what can we bring down early in their career and develop those skills? And workforce needs. In Rhode Island, our practice partners told us we need CNAs. Okay, we have a curriculum, we plugged in that entry-level patient care workforce certificate. And then a few years when Rhode Island, we need EMTs. We plugged in EMTs. And again, what we're finding is the EMT also led to, there was a huge shortage of emergency room nurses. So our EMTs worked as they went to college, worked in high school, worked as they put themselves through college, and then becoming emergency room nurses. So I am the CEO of the Nurses Middle College. However, the Rhode Island Nurses Middle College, that's our flagship. We knew early on that Rhode Island is not the only state that needs more nurses and healthcare providers, that are very concerned about the lack of diversity in our healthcare workforce, and that we needed to do something about it. So we have been focused in Rhode Island, and we've been operating for 10 years and believe that we have the recipe. And so the Rhode Island board created a 501c3 nonprofit organization, Nurses Middle College, and that is the organization which I am now CMO, and I have my team here, all coming up from the Rhode Island flagship school to work with other communities to replicate this model. So we opened Providence in 2011. It is a public charter school, which means that it is a public school. Students pay no tuition. We chose that model because that model provides a flexibility. When you're building something from an idea, scratch notes, which that's how it started, to the charter provides the flexibility, and it's a public school and it's access. I have to admit that over 15 years ago, I didn't know what a charter school was. So and so we learned from our education partners what that was, and so we worked with them and we opened as a charter school. We serve grades 9 through 12, and we're a school of 500, large enough to have impact on the community, small enough to keep that relationship, the interdisciplinary, knowing our students, because we our individual learning plans for our educators are our care plans for our nurses. We need to know students, and that's how we develop an individual plan so we can get them, they can see their path and eliminate those barriers. And the exciting thing is my nursing colleagues and healthcare providers in Albany, New York, the capital region area, nursing small, and said, what are you guys doing in Providence, Rhode Island? And said, come on down. And so they toured the school and they said, we're ready. When you're ready, we're ready. We would like to open a nurses middle college. So we connected, created a founding board of industry and nursing leaders. We wrote an application, we submitted the application, and we were approved through the SUNY authorizer. And we are so excited to be opening the fall of 2023. And we will only enroll in 9th grade. That's not an ideal, I'm looking at my CFO, that's not an ideal business model for charter schools because you only get paid per pupil, but that is our model because we're focused on academic success. So we figure it out, we enroll in the 9th grade, we know students achieve and do better when they're with us for 4 full years to have the breadth of the whole 4-year curriculum. And then we add every year to the 9th grade until we're at a school of 500. So we're so excited to be invited here, and we share our model, and this organization is driving and open to working with communities who want a nurses middle college model, and work with them to launch and manage to ensure excellence. And that has to do with collecting data and its evidence to make sure that our students and all the nursing middle college schools are really thriving. And having a whole network, a national network of schools, will be able to really collect data and learn and best practices. And what's exciting about this model, it's taking 2 very exciting, well-respected, human-centric professions, health and education, and working together and creating this model. And over the years, we have found we're saying the same things. You're saying individual learning plans, we're saying care plans. It's we think that we're strong together. So nurses middle college graduates are college and career ready, and students have multiple options following graduation from a nurses middle college. So many of our students we meet students where they are and where their life experience. And we have many students who say, I am ready and I'm going on for a bachelor's degree. And they're taking with them up to 20, 24 college credits with them that are completely transferable and the prerequisites. They have saved money, and they have taken a semester off their college journey, sometimes a whole year off their college journey, and they are ready and they're on an accelerated path. And others, where they are in associate's degree, So we have a community college in Providence. We have a community college partner in New York. Many of our students, where they are, they're going to go to the community college in Rhode Island. That is a free education. So our students are coming with free already college credits, and then they go through the Rhode Island program, which is a free associate's degree. So that's costing them. And then our community college has an articulation agreement with the University of Rhode Island, and our students then transfer, and they're able to become a bachelor's prepared registered nurse in less than 4 years. And some of our students go directly to the workforce. They already have experience. They have a workforce certificate. Our healthcare practice partners are come, and then they say, work for a year and I'll pay your college. Because our healthcare practice partners see that it's the advanced provider that they're succession planning. So our impact. We're the #1 school in the state of Rhode Island for college coursework and workforce credentials. 85% of our students are from our urban core community. More than 88% of our students meet the federal guidelines for free and reduced lunch. Our students come to us in 9th grade. We know well below grade level. We believe in educational opportunity, and that has nothing to do with intellectual ability. And we've built a robust curriculum, and we have a designed curriculum that is to get students on grade and then to master college level coursework. And I think all our design elements, which is evidence-based, has really created the outcome. And the second school in Rhode Island for workforce credentials, not even close, is a very affluent suburban community. Part of our graduation requirements, you can't earn a high school diploma until you've met all our rigorous college prep curriculum. You've had a robust internship, which you receive credits, and you've earned a workforce credential. So this isn't just these are the opportunities. If you want to come to our school and you love healthcare and nursing, we're here for you and we're going to get you there. So that's part of our graduation requirements. And as you see, our students are exceeding in their college credits. And we're particularly proud of the class of 2020, because that was a time, and I'll never forget, it was March, it was Friday the 13th, our Commissioner of Education called us all up and said, pack up. It was like 1:30 and we end school at 3, pack up. There's a pandemic and we'll see you in 2 weeks. And we never saw seniors again. We saw them on Zoom occasionally, but I think they were committed. And then we did not see our students to the following fall. And our students in class of 2020 ended strong. 100% of them. So we're so proud of that. So the return on investment and how we define success is not high school graduation rate. We define success at entry into college or workforce, persistence, degree completion. Again, our motto is we're in the workforce and we look down. So that's our measure of success. So return on investment, when we come to our partners, it's long. And so we've had a total of 384 graduates thus far. Our total graduates who have already graduated from college, this is not including, we're collecting the data now, our December and our May graduates, college graduates, but 230 of our students are in the workforce and are graduated from college in healthcare. We're looking at our college enrollment, and 76% of them, the remainder, are still in the college pipeline. As with, I think, everyone's experience, COVID was an anomaly. So our students did take a pause in their education. I know in Rhode Island, the healthcare providers shut down and they couldn't take the clinical internship. So a lot of them could not finish their college coursework because they shut down the student experiences. So many the students went back and they're still in the college pipeline. But when we're looking at for college enrollment, 75% of our students go right into college. And as I said, many of our students work with our healthcare practice partners, and that enrollment into college jumps because now the employer is paying for their college tuition. We were highlighted. This is the National Academy of Science, Engineering, and Medicine, sponsored by the Robert Wood Johnson Foundation, created a report. It's the future of nursing for 2020-2030. And this is charting a path towards health equity. And here, this is the roadmap for health and nursing and how we're going to move this country in meeting health equity. And we're highlighted as a model to have impact because our focus is preparing young students. Our focus is on diversity. Our focus is on educational opportunity and the passion and love for a career in healthcare. So this is Jai, and this is a nurse. This is a Rhinai graduate. She graduated from our Providence school, and our school uniform is scrubs. Our students, our ninth graders, they come every single day in scrubs because they're dressed today of where they want to be. And so, but this is Jai. She's a registered nurse, baccalaureate prepared. And she said, when we collected some qualitative data, she said that, you know what, I always thought about going to college, but I'm not sure that I would have. And it was knowing what she wanted to do was her driving force. And I remember Jai said, and this is what we hear stories all the time. Jai didn't do very well in middle school. And she said, Dr. McHugh, I had all C's and I thought about college, but because we are all in, you come here and we're all about nursing and healthcare, she saw the clear path. It was the elements of the curriculum and all the internships. And she said that created her drive. And she's not sure if she would have followed through if she didn't know early on what she wanted to do. And this is Amber, another registered nurse, baccalaureate prepared. And as I said, our students wear scrubs as uniforms to school every single day. And she said that the dress code instilled a sense of confidence that made her feel you matter. You're important. You're becoming something important. And she said, here she is, a young woman in healthcare, and that people looked at her differently. And she took public transportation. Most of our students, we serve all students in the state of Rhode Island. Rhode Island is very teeny small, so we can do that. You only need one high school of this. And our students take public transportation, and they say wearing scrubs gave them a sense of confidence. People actually got up and gave their seats, and they really felt like that was all built into their self-confidence and engagement in the program. And then this is Dwight, and we, as I said, that we had the CNA, and then we plugged in the EMT because governance practice partners at the board level said we really need EMTs, we need emergency room nurses. So we added that in a few years later. And Dwight's goal, and he's still at the University of Rhode Island pursuing his registered nurse degree. Emergency room nursing is for him, but he became a CNA. And Dwight said that reflecting on his journey, he works a lot with CNAs now as an EMT, and he understands their role, and he's an excellent team player. And then he's saying, one day when I get my nursing degree, I'm going to look back in EMT and at EMTs and say, I know where you've been. I understand your role. And again, that just solidifies the patient care team. And we have students who just say, medicine is my goal, but to start at the bedside and to work with patients from that holistic approach, we see the future of physicians and all healthcare providers really having that interdisciplinary holistic approach to patient care. And that is it. And I'm happy to answer any questions.
Thank you so much, Dr. McHugh. So I have one question, and then we'll open it up for questions that folks here have. You talked a little bit about the connection between your industry partners and the school. I thought one of the things that was interesting was the fact that you have on your governing board members of the nursing community and post-secondary institutions that are in nursing. But I wonder if you could talk a little bit more about how you ensure that there is that close partnership between industry and what's happening at the school. How does industry inform what you're teaching? Are there commitments that industry partners are making around internships or mentorship or job placement? Just would be interested to hear more about that.
Excellent. So it's an industry-run school. And the lead of our school is an executive director who's a registered nurse. And we have a school organizational chart where we have nurses and those from the industry taking on certain roles. So it's at the governance that we have nursing and healthcare to inform us of trends, but also we have staffed we have nurses and healthcare providers teaching in the classrooms, and they are content expert for our teachers on how to integrate nursing and healthcare knowledge in all core content subjects. We do ask for our practice partners. There is a commitment. Our internships are driven by an MOU. Where we promise and they promise certain things. So it is threaded within the organization. At the governance level, all policies to ensure that they are a mission-driven vision. We're very experience is being the lead, so that's how we replicate it. But we have threads, and we have adjunct clinical faculty who come from the workforce. So we are a industry-driven workforce model embedded throughout the entire organization.
All right, we'll open it up for questions. Yes, Bob, I'm gonna give you the mic.
First, congratulations, what a great program. By using industry people as your teachers, what kind of licensure requirements do you have for them to become teaching in the class?
We're a high school, number one, and so we do have certified teachers. But our nurses are a part of our interdisciplinary student support team about how we address all the other areas. We also have the nurses delivering the entry-level patient care workforce certificates. In our high school, the CNA, that's governed by the Department of Health, and they dictate who could be teaching that. We also have mentors. That's another way how we connect our students early on with professional mentors. And our nurses, we have leaders, we have a director of nursing, we have clinical adjunct faculty. Our school nurse is a full, robust. Not only are they also caring from the health perspective, but they are also the role model. And then our math teachers, our history teachers, our English teachers, when we say we have a curriculum that's specifically designed for them, so when they give examples, they're authentically healthcare. But we do not have nurses teaching math. We have certified math teachers, but if they're going to give an example, they plot epidemiology. They were plotting COVID. Prevalence of COVID cases. That's where we really bring the industry together in the classroom.
We have, two questions over there. Yep.
Oh, thanks. Love the idea as a physician. So question for you, you bring in all comers, right? how many of your graduates need more than 4 years, or do they spend extra time in the summer, or how do you navigate and close the gaps so they meet your rigor?
Yes, yes, yes. So, so that's the individual learning plan or the camp plan. We do a lot of assessment. So when our students come for us in 9th grade, we do culture building cohort. We find that they are 9th grade is a cohort, and then they support each other in 10th grade and 11th grade. So we do assessments, and we find out where they are. I'm looking at my curriculum and instruction team member. So we find out where they are in math proficiency and ELA. Many of our students are multi-language learners. And then we create a learning plan. Some of that will be after school support. Some of that will be, we have the students come to us longer in the school year, more than required. We do summer programming. We do after school programming. So we just meet. And yes, life happens, and some of our students may have to do an extra year in high school. But we go all year round. We don't close and disappear. We have lots of summer programming. And we have lots of specialists. So we'll have small classrooms, and we'll have the math teacher and a numeracy specialist, and they are in the classroom. And we do small groups too. And differential learning is we take it to the next level. So we may have 4 grades of math. We have 5, 6 math teachers, a numeracy specialist. So it's the wraparound services.
Hi, I'm a 29-year educator in career and technical education, so things like this make me very excited. But I have a question. Speak to what you do with your middle school students to recruit, encourage, and your advisement of those middle school students to move them into this school.
Well, we visit middle schools very often, and we bring our students, because often young people want to listen to young people. We have summer camp. We have some fun, cool stuff. We have this synthetic cadaver, and you can get in there and you can touch the intestines and you can touch all that kind of stuff. We give stethoscopes. We teach how to so it's very hands-on approach, and word of mouth. We're in the community. We have a waiting list. We only enroll in Providence in 9th grade, and we enroll about 120 students. We have 400 students on a waiting list, which is, challenging, meaning we wish we could serve every student, but also what we do is we are in it for healthcare, and we can't produce every single nurse and healthcare provider. So we work really closely with our public schools, and we offer summer programming, the workforce certificates, and after school. And then they go back to their school, and they have on their transcript, they've got a workforce credential, or they've had a credit in art that we have created. So, and as I'm saying, we've got the curriculum, we've done the research, we have the recipe, and now we are looking for other partners. And that's how New York said, please bring this model to us. And so we've worked with it's the Nurses Middle College Capital Region, and we've done a crosswalk. The state education requirements, basic education program, graduation requirements are different in New York than they are in Providence. So what we do is we do a crosswalk, and we're all about standard-based grading and mastery of skills. And now we're ready to launch and manage the Albany School.
Right. We probably have time for one more question, and then we're going to move to our panel discussion, if there is one more question. You can have a second question if you want. Okay, great.
Hi, can you speak a little bit about your charter authorization? Was it at the local level or at the state level? I'm not sure how it works in Rhode Island, so if you could explain, that'd be great.
So we've had the pleasure of going through two. So we have lots of experience in Rhode Island. It is the Rhode Island Department of Education, so it is the state. In New York, it could have gone. There are two authorizers: the State Education Department of New York, or SUNY, is a charter authorizer. We spoke with both. Both liked the model, and both would have been great options. We chose SUNY because the rigor we wanted to make sure that we were launching a model that we could replicate. So we went with SUNY. There is some politics of charter schools, definitely in Rhode Island and in New York. However, we were able to navigate that and receive no opposition because we are an industry-run school and no one can debate the need for nurses and healthcare providers. And I think after the past 2 years we knew it, but with the pandemic shining a spotlight, we've had no problems with authorizing.
Dr. McHugh, thank you so much. Please join me in thanking Dr. McHugh for being here today.
Thank you.
All right, we are now gonna turn to welcoming a panel of Tennessee leaders to reflect on this conversation and then talk specifically about some things that are happening in our state to solve for this connection between high school and career. So would like to ask our panelists to come up, and I'm going to just start by introducing the moderator for our panel this morning, Dr. Sarah Hayburn Morrison. Dr. Morrison serves as Executive Director of the Tennessee State Board of Education. In this role, she works with the 11-member governor-appointed, legislatively confirmed board on policy review and development across all areas of K-12 education. The state board also plays an important role in oversight of K-12 implementation, which involves close partnerships between the Department of Education, educators, stakeholders, and members of the Tennessee General Assembly. Prior to joining the state board in 2015, Sarah served as Assistant Commissioner at the Tennessee Department of Education, as well as the K-12 Policy Advisor in the Governor's Office, and began her career in education as a high school English teacher in Middle Tennessee. Sarah, thanks so much for being here and for moderating this panel. I'll turn it over to you.
Great, thank you so much, David. I know I'm not alone in saying that was really inspiring. Thank you, Dr. McHugh, for being with us in Tennessee. It's always so helpful to hear about the models and where we can aspire to grow and learn as a state. So I'm excited now to turn to our Tennessee leaders and want to introduce our panel. First, to my left, we have Dr. Teresa McSweeney.
Good morning.
Chief Innovation Officer at the Jackson-Madison County School System. Dr. McSweeney first began her career as an English teacher, as did I, at Jackson Central Mary High School, and later served as the principal at Rose Hill School. She has a track record of bringing new ideas to JMCSS, and in 2020, Dr. McSweeney started the district's first cyber school, Jackson Academic STEAM Academy. Yes. That's a mouthful. As the Chief Innovation Officer, Dr. McSweeney assists the district in rethinking school, providing opportunities for students, and overseeing grant funds, as she has been integral in the planning and implementation of the district's Innovation Impact Institutes. We're excited to hear more about that. Welcome. To her left is Dr. Carrie Randolph. Great to see you. She is the Executive Director of Chattanooga 2.0, the Cradle to Career Collaborative of Chattanooga, Hamilton County, Tennessee, that aims to transform education and workforce development outcomes. Dr. Randolph has more than 20 years of experience working and advocating for children and families through diverse roles across the education sector, from classroom teacher to nonprofit leader to cabinet level executive of two of the largest school systems in Tennessee. Welcome, Dr. Randolph. To her left is Dr. Rita Summers, who was appointed president of the Tennessee College of Applied Technology Dixon in 2014. Before being appointed president of TCAT Dixon, Dr. Summers served as the assistant director of the TCAT Nashville, before being selected to lead the college in Crump in 2012. During her tenure as president, Dr. Summers has supported the development of numerous innovative high school models, including the Early Technical College at TCAT in Clarksville, Montgomery County Schools. Welcome. Thank you. And last but not least, Dr. Mamie Williams, who serves as the Senior Director for Nurse Diversity and Inclusion at Vanderbilt University Medical Center. She's the co-director and task force member of the Academy for Diverse Emerging Nurse Leaders at Vanderbilt University School of Nursing. Dr. Williams is responsible in that role for fostering collaborative partnerships with nurse leaders, staff, and faculty to ensure Vanderbilt's nurse work environment exemplifies diversity, equity, and inclusion best practices. Her responsibilities include expanding efforts to create sustainable system for diversity, equity, and inclusion in nursing, working within the Vanderbilt medical community and engaging the broader community as well. Please welcome me and join me in welcoming our panelists this morning. All right, so my first question is for all of you, and we can popcorn answers or go down the line. I'll let you all decide. But we just heard again from Dr. Pamela McHugh about an innovative high school model in Rhode Island that is inspiring, and it's preparing students for jobs in nursing, both directly out of high school and for future post-secondary opportunities. Each of you, as I mentioned in your introductions, are also leading or considering innovative high school models in Tennessee. Can you each just start by sharing a little bit about the work that you're leading and how it's helping students earn workforce relevant degrees, credentials, coursework while in high school? Like I said, you want to popcorn answers or start with Dr. McSweeney?
Sure. So we started with our innovative high school model grant application, and we envisioned reimagining CTE and embedding more employability skills into those courses. So what we started with institutes, but we also wanted to include some academic institutes that weren't necessarily career tech education. And so with the institute model, we designed them in ways that actually prepare students with those employability skills. So we have investor meetings, the students actually, we are the board as the innovation grant team, and we hold the students accountable for understanding how the money is invested. So the institute model, I think, is going to be replicable. We'll see if we're able to replicate. But we also want to ensure that every school had something, which is part of what the governor then, with the new design with innovative school models, every school has a grant. So I could talk about that a lot beyond.
How many high schools do you have, just for context?
We have 7 high schools in Jackson-Madison County.
Wonderful. Yeah. Thank you. Dr. Randall, we'll just go down the line.
Sure. So Chattanooga 2.0 is actually born out of workforce challenges that our kids weren't in Chattanooga, Hamilton County, weren't connected to the opportunity. Think back to when Volkswagen opened, you're probably familiar with. So we were born out of that, and we have set a goal of creating 10 viable pathways to prosperity over the next 3 years in collaboration with business and industry, post-secondary, the school system, as well as the nonprofit partners, because we have identified the following criteria for those pathways. They have to start with a thriving wage job out of the gate that provides benefits, but also be connected to a career pathway that we can explain to kids and families from day one. It has to involve inspiration and exploration opportunities as early as upper elementary school, because we know that that's when kids start deciding what they want to be when they grow up, so we shouldn't look away from that. I think of it like a funnel, so those experiences get deeper and in more depth as they get into middle school and high school. And then from there, we remove all barriers to the post-secondary pathway connected to that thriving wage job, and we have wraparound supports from food, transportation, and housing that we're providing. So we've built one pathway so far, and that's a line worker pathway. The starting salary for both telecom and electrification line workers is $60 to $80K. I'm a little concerned about losing some of our teachers to that pathway, so I'll put that out there. But we have raised the funds and have a monthly table that is set with business and industry. They have promised to hire every graduate from the program. It's a 12 to 15-week training program. So those are our really important criteria. I will also tag, in case you're interested, we also are leading work around pre-apprenticeships and apprenticeships in the community with a goal of expanding existing apprenticeships, as well as creating new innovative apprenticeships, which are mostly in IT. So we're also leading that work, and the partners for that work are the City of Chattanooga, Hamilton County Government, and Hamilton County Schools, and they're investors in that work as well.
Wonderful. Thank you.
Well, my partner is here today, Dr. Dana Payne, and we have the privilege of offering an early technical college at our Clarksville campus. And like Dr. McHugh, our mission was student success and workforce development. And that's the same model that we have used since 1964 for our adult students. we didn't look at it as something new. It was, how can we apply what we do in a new way? And so taking our knowledge to a fresh sheet of paper, I think, is what was instrumental. We didn't start by saying, well, how have we seen dual enrollment in the past? How have we used dual credit? What's been done before, and how do we build off of that? Instead, we said, what can we do, not what have we done? And I will say that we had started this conversation earlier with a different administration, and it didn't really go anywhere. So having the right partners at the table is key. And so it was just a different day. And so one of the things that we learn is when the door shuts, sometimes you just wait for another door to open. It doesn't mean the end of an opportunity. It means you might have to go back and get out another napkin and start scribbling all over again. One of the things that I like about the early technical colleges and what I hear from this middle college is finding that success early, before students have their attentions drawn elsewhere. And, you know, there's a myriad of ways that could happen, but capturing them as an 8th grader or a 9th grader is really key. And I think that that's important. And in the long run, our workforce have a larger pool of applicants without a delay when we can do that.
Wonderful. Dr. Williams.
Yes, thank you. Being a healthcare partner, it's interesting to hear the ways in which education is being addressed to help us with our nursing shortfall. So I'm a nurse, and we are acutely aware of just how dire we are in terms of producing nurses. So part of what we decided to do early on was to reach out to our local education institutions and find ways that we could help to support, you know, the current programs, find ways that we could help offer mentors, find ways that we could help to, as Dr. McHugh pointed out, inform the curriculum. We know best, you know, what is needed in terms of what makes for a good nurse, what is needed in terms of skills. And so we went to, for instance, a middle school here in Nashville and set up a skills lab so that the students could be introduced, because as they have all pointed out, early on is when, you know, we need to introduce folks to nursing so that they could be introduced to what nurses do, what are some of the equipment that nurses use. We have them to train in a hands-only CPR, so they understand just how, you know, impactful working as a nurse is. So we really wanted to reach out to the different educational offerings and become a partner, work intimately with those schools to help produce what we will ultimately need, because we know that how we have been doing things is not going to be successful. It's not going to help us overcome the 100,000 nurse deficit a year that we're facing if we continue in the same path. So reaching out to our partners, offering mentorship, and also offering, opening our institution up to have those students come in and have an opportunity to shadow, and in some cases intern. So that's the ways we've attempted to address it.
Wonderful. Thank you. I'm going to follow up now with a few specific questions for each of you. So I'll start with Dr. Randolph, Carrie. And as you've described, you're deeply engaged in the community to workforce connections in Hamilton County. How have you worked together as a community to define credentials of value, and what role has data played in making that connection between education and the workforce?
Yeah, it's a great question, and we've tried to be really opportunistic. I will say, as someone who's been in the state for a long time and worked in this area, I've not seen business and industry come to the table like they are right now. And I feel like we really have to take advantage of that for our kids. So, and what I mean by that is they're facing a labor shortage, right? And so they're just willing to partner in ways that you've heard it described already today that we haven't seen in the past. I think one of the biggest challenges, though, is still bridging the gap between the education and the workforce. Like, for a long time, business and industry has just kind of been able to say, we're not getting what we need, we're not getting what we need. And what educators have been trying to say, tell us what you need, tell us what you need. What's unique about now is we have business and industry rethinking their qualifications. So Unum, for example, a huge employer in Chattanooga, is actually looking at all of their baseline qualifications across all of their roles. They're like, is this actually what we need? What they've decided is no. So in many cases, no, we don't actually need a bachelor's degree sometimes, or we don't need this, or we don't need that. So we are trying to set a table where we've got them at the table with schools, with higher ed, to talk about what they do need. And we can then respond with modified credentials and with modified curriculum that are actually connecting kids and our teachers. We have to remember our educators need this too, to it. And so it's a much different way. Data is really important. And I'll tell you, K-12 is data heavy. We have lots of data. I'm finding that in many ways, business and industry doesn't have the data that we would like to see from them. They don't have forecasting data. I would say healthcare is an exception. There are a few exceptions. TVA is an exception. In Chattanooga, they can tell you exactly what they need and when. But for many of the other sectors, they are dealing with a workforce shortage that's right in front of their face. When you're building pathways and pipelines, we have to make sure that's sustained for the long term for our kids. So we're having these really interesting, more collaborative conversations than we've been able to have in the past because of those challenges, and really having deeper conversations about what credentials are actually needed. And I'll say we're finding in some cases the credentials are outdated. And so we've got, I think, work to do in that case as well. So the data, we're actually building a data system, because I would say a lot of the data I assumed was already out there is not out there. And so we're working hard to work with business and industry to get that data so that we can be really informed and do this in a really strategic and forward-thinking way.
That's great. Exciting to hear. Next question is for Dr. Summers. And as David shared, in Tennessee, we're not seeing enough high school students graduate with credentials through these innovative high school models like Dr. McHugh shared this morning. So as a higher education leader, and particularly given your experience launching the early technical college in partnership with Clarksville, what do you think is the role of post-secondary in terms of helping to design these industry-aligned high schools?
Everybody's busy, right? Business is busy, and a day off the floor is maybe a day that they're not making something. And K-12 is busy, they're doing the things that they do, and higher ed is busy. But at the end of the day, as time consuming as it is, the partners have to come to the table. Communication is key. And it's really saying we can't afford not to take the time to come together to make these plans. And that's what it really involves, is finding out where the needs are, where are the gaps, thinking with the end in mind. We have to talk to the employers. Then we can go back to the K-12 system to see where they're working in that arena, and then as possibly a middle partner, how do we minimize the time that the student is going to lose if they're doing something twice, right? If we can capture credits in high school and use that. So I think communication and being that hub, if you will, and of bringing it forward. I think that it's important that the higher education look at itself as a partner in both placing that student who wants or needs to go to work right out of high school, but also showing the pathway that you can come back to TCAT. We work on stackable credentials. The goal is that we get the student some credentials, some skill sets that can get them into the workforce while they are working their way through college as an adult, if that's what they need. I think that bringing the partners to the table and initiating those conversations is key. For us, it really came down to, we had space in the evenings that was not being utilized. And we had 7 high school feeders with another high school coming on, and asking the school system, what do we have that you don't? What could we offer your students if we could come up with a model that you could utilize our space after our students leave at 2:30? And we started with diesel, industrial maintenance, and heating and air. And then we looked at one of our day programs, and it was a brand new one. It was pharmacy technology, and it wasn't full with adult students. So then we said, well, why does early technical college have to be after 2:30? So we started backfilling spaces in the morning, and then the high school flip-flop. So allowing them to come on and teach their math, science, history, and everything on our site, and then we teach these other skill sets is really a result of conversations.
Very exciting. Thank you. Dr. McSweeney, so Jackson Madison, you mentioned this in your opening, but has recently launched the Innovative Impact Institutes at each of the 7 high schools in Jackson. Can you share more about how you worked with the greater Jackson Madison community in developing the vision for those institutes and the partnerships that were necessary to make them happen? And also how the funds that the state has made, in particular around innovative high school models, supported the district in being able to think differently about high school?
Sure. So we first worked with the Chamber of Commerce to identify those areas of employment in our area that we would want to focus. In other words, what do our industry partners need in terms of employees, and what sort of skills do they need? And that led to conversations about identifying the institutes within the school. So there were some principals who had particular programs who they really wanted to be an institute, but if it's not a program that is going to lead to a job in our area, then that's not where we want to invest our funds. So we, again, invited the industry partners to the table, and they are, as you said, eager now because we do have a workforce development shortage in our area. So one of my favorite stories, and it plays well to what Dr. McHugh shared, our clinical intern students couldn't get into the hospital. So that led to a conversation with the Workforce Development Department and the HR department at West Tennessee Healthcare, which is the largest employer in Madison County. And so that led to a conversation about how could we get those students in? They can't do clinical internships right now, but there is a shortage in environmental services and food services. They can now become employees of the hospital. It's not exactly what they intended, but it got them in the door. So that led to an entire expansion of what we call LOOP, which is our Local Options and Opportunities Program. Started in advanced manufacturing with 21 students in 2019, and it has grown to 143 students as a direct result of the funds provided from the Innovative High School model, because we were able to put people in place to expand that program. So it has expanded into West Tennessee Healthcare. What was interesting about the original model fit within the school day, but the state said reimagine when and where students learn. Well, that gave me permission, so I could just reimagine all sorts of things. That allowed us to say, okay, the high school day ends at 2:15, but the hospital needs workers who come to work for second shift. As a matter of fact, so does manufacturing. Why can't the students work second shift and still get high school credit? All we need is a teacher to agree to shift their work schedule. And so that allowed us to reimagine when and where students learn. As a part of that partnership, that grew into another partnership with our local utility company. They wanted to build a program where the students actually go through 3 separate departments, and at the end of their senior year, they have the option to come to work at the utility company. And what happened, this is the pilot year, is that the departments fought over the students, which, and the students actually had the choice. So that was really fun. But here's an interesting thing about reimagining. If you're out on a line, if you're out in another county, they couldn't come back to take a class. So we had to totally rethink the school schedule that allowed them to go to work 3 days a week with the utility company and go to school 2 days a week. So again, thanks to the encouraging and the challenge really from the state of Tennessee to reimagine when, where, and how students learn, as well as our industry partnerships, we're able to think completely differently about how students learn in high school.
Really exciting. Thank you for sharing.
Sure.
And lastly, Dr. Williams, in your leadership role at Vanderbilt Medical Center, you're working with numerous partners in Nashville to create a robust and diverse pipeline for nurses. How can industry leaders like yourself lead the conversation for what programs like yours look like and others in terms of what's needed in Tennessee?
Thank you for that question. We, first of all, have to outline for ourselves what those needs are and how we're going to approach different educational institutions. And I say that because we've not in healthcare done a very good job of explaining to students what the particular roles are and what it is that you do. I went to a high school recently and talked with 2 young people, and they said to me that becoming a nurse was a fantasy role. And I was disheartened because it's a very attainable goal to have, and there's a path that you can follow to do it, but they were completely unaware of it. And part of that has to do with healthcare and kind of keeping what we do in this ball that's, just in healthcare. And so folks don't fully understand it. So I think we started off by having opportunities and going out and talking to young people about the various different careers. We've gone to Preston Taylor. They have a student-led ministry, and we've talked to them about the various different healthcare roles. We've offered our nurses as mentors. We've offered them as adjunct faculty to help with education. So we have to do a better job of explaining how and why becoming whichever role in healthcare you want to pursue is beneficial, and the potential impact that you can have. And then using our resources, our professional nurse organizations, our retired nurses, to help us to be in these education settings and working with young people so that they understand what they can achieve. And both education and healthcare will have to come together and outline those things much better than we have in the past.
Great, thank you. All right, I've got 2 last questions. We've heard this morning a lot about the power of industry-aligned high school models that prepare students not only for the workforce, but also future post-secondary opportunities. And yet we know from the data that David shared that these models are not happening at scale yet in Tennessee. So my question for all of you is, what barriers do you see that exist in Tennessee that we need to address in order to expand and strengthen these kind of industry-aligned models? And I'll leave it to you. Do you want to popcorn? Start with Dr. Williams this time.
Well, I just have to go back to the point of we have to help families and students understand these opportunities because I don't have children, and so I've not been involved with education very intimately, but I do know, young people and can talk to them about opportunities, and a number of them are not aware of these other opportunities outside of, just their, local high school. And so this is great that we're doing this here, but I wonder how beneficial it would be if parents could hear these things. So I think there's an opportunity to get this information out to a wider audience so that students can feel that they have an opportunity outside of, just a straight college path, and that there is a benefit of finishing school. I know that once you introduce nursing into a family, my family in particular, as an example, I was the first to do high school, the first to do college and become a nurse. And now there are 6 other members of my family who are nurses. So it is something that you have to be introduced to. You have to understand what it is to be able to pursue. And so I think we really have an opportunity to have families and students understand it better.
Summers, we'll just.
Yeah, so I think some of the answers that I have really echo Dr. Williams, and that is that so often the young people, and I'm talking 6th, 7th, 8th grade, they only know what they know, what their parents do, or maybe grandparents, aunts, uncles, or they have this idealized idea based on something they've seen on TV that they think they want to do, and they don't always connect their own ability to do those things, or whether or not they'll even really like doing it in the end. And then going back to the idea of the parents, they spend a lot more time with their children, and sometimes the parents don't understand the opportunities that are out there. So I really think that there needs to be a lot more career counseling. It needs to be an individual that is their focus in the school system, that they're not testing, they're not doing other things. It can't be a sliver of someone's position to be able to show students about the world of work and the world of opportunities. And so I think that that's one of the barriers, and the solution that we could follow is like the AIRS Foundation puts counselors in high school, and that's what they do. I think for us, space is an issue. We can use my building at night, but what do we do when they come there? Where do I put them for their math? It takes 4 classrooms now. We had to bring in portables, then we had restrooms, then we had water issues, and we're still navigating some of these things. So having increased space to operate 2 schools on one site. I've been to the Construction Career Center last week for a tour. Fabulous. Takes money and it takes partners to do that. So I think that really sums up where I think we could do a better job at relieving barriers.
Great, noted, thank you. Dr. Williams?
So I totally agree with what you said. So we'll just underline that and say, I think we have a teacher credentialing challenge. We need teachers working with our high school students who can teach these high demand courses, and we can't attract them because we don't pay enough to get them from industry. So we are going to have to address that. And, you know, I think Dr. McHugh and the model they're using is something to consider, but it's a huge challenge. And I think there's some policy work to be done there. We have accountability on the schools for teachers to be successful. So let's loosen some of the credentialing requirements so that we can respond. I also think we aren't responding quickly enough around career clusters. And so, you know, innovative career clusters, like I'll throw out AI, which is one we're all thinking about. We've got to be more responsive at the state and policy level to open doors, to encourage the innovative thinking that's happening in Jackson-Madison, and to make those models more possible, and for people to be encouraged to do those and not run up against barriers. We run up against those all the time. And then look, when you see the dual enrollment numbers, we need to dig into the why behind that. I have a lot of ideas around those whys. I mean, I think that we've got to look around what we're defining as an early post-secondary opportunity. Like, I cannot explain right now why work-based learning isn't one, for example. If we're encouraging that, and we really think that that's preparing kids as ready graduates, then we really need to look at, you know, are those definitions and requirements that we're putting on schools, because they're trying to follow the rules, but the rules are constraining them and what they're hearing from industry and business and what's actually possible for kids. So I was going to go deep on the policy barriers that I think we face
state
every
accountability.
day. Yeah.
I think we need a mindset shift. I think that we have emphasized college, 4-year college, as the only option, and we weren't wrong. I was part of that movement 20 years ago as an educator. We weren't wrong, but we were a little misguided. And to give you an example, just recently I had a birthday party for my son, and one of his friends came over, and I was overhearing, and I heard him tell my husband that he was a welder and then apologize. I'm just a welder. It shouldn't be that way. Our students shouldn't feel at 26 years old that they somehow missed our expectation for them. And so we have to shift our mindset and shift toward those credentials that lead to employment. And with the shortages that we have, our industry partners are looking to our 18-year-olds to fill those positions. And Madison County is one of the highest decreases in the number of students going to college across the state in comparison to across the state. But I think the reason is there are so many excellent jobs in Madison County. Why would I put off for 4 years to the earning potential that I have right now? And I think that our young people, this generation, they're getting that message in a way that a couple of generations or a few graduation classes ago they didn't. So I do think those workforce opportunities are important, and I would love to see that as an EPSO, because we're growing in that area in our county, but we also need some instructor awareness. So the Ready Graduate helps, because in our county where so many fewer students are going to hit it for ACT, we're working on that, but we're still relatively low in our county with ACT scores. The EPSO is a great alternative. That means that our teachers have to understand what those credentials are in their area and be willing to offer that as well.
Great. Yep, lots more to dig into. And I know we're getting close to time. Okay, so rapid fire, 30 seconds or less. You've got industry leaders in the room, you've got educators in the room, you've got policymakers in the room. What's one action from your vantage point that we could take to advance these innovative models in Tennessee? One step, and it could be hitting something that you've already said, but if you want to leave the audience with one step that we could take.
I'll start. I think we really need to open our doors. Healthcare facilities, we have those restrictions on, who can be there and at what time. We have to open our doors. We have to become not only partners in word, but we have to in action have our staff nurses, have our whichever other healthcare folks in the schools, serving as adjunct faculty. We have to involve our professional organizations in helping us outline to the schools what we need and how we need them. So we really have to be just more active with our education partners in all, private, public, and in between.
Great.
I think that we should have a type of database in Tennessee where there are one-page little mini white papers on all the successful programs and maybe even not successful programs in Tennessee. Who, what, where, when, why, how, and what benefits have been achieved, where I could go in and click on dual enrollment, or I could click on manufacturing, I could click on healthcare and see what other school maybe in Blount County is doing in this area. What can I learn from them? And then because the contact information's in there, I can pick up the phone and call and go see what they're doing. Too often I come to these types of events and I hear all these things that have been happening for years in my own neighborhood and I didn't even know about it. That's delaying implementation when we don't know what exists.
I would say, with my friend here, I think anything we can do, coming out of the pandemic, I really hope we were going to reimagine school. I would have to say, I think we failed at that. But these break the mold pilots and innovation pilots, let those bloom right now. We have the right conditions, and then do what you're talking about and capture that information so we can inspire one another. I think there's a lot of ideas, and again, leveraging the labor shortage, which don't know how long that window's open. We can come up with some really innovative things, and so let's allow that to happen.
And I would say, come to Jackson, come see what we're doing. All are welcome anytime, but truly, wherever your district is, get involved with your public school, because there's somebody in charge of innovation now in every district, even if they don't have a Department of Innovation. There's somebody there who's reimagining. And so find that person and bring those ideas, because there's never been a better time than now to be innovative in our schools.
What a perfect line to end with. Join me in thanking our very talented panel.
Thank you so much, Sarah, for moderating this great discussion. Thank you to our panelists for being here today. Thank you again, Dr. McHugh and your team, for being here. Really inspiring examples and work that you're doing. Thank you all for being with us for this conversation today. I will just note, because we're slightly over time, that our next event in this series is July 19th, I believe. Is that right? Where we'll be talking specifically about rural work at the intersection of education and workforce in Tennessee. Hope you all will join us for that session. Thank you again for being with us today, and we are dismissed. Thank you again. We're not with